Hello, you're watching Smart Money, and today we're catching up with Deon Kotze, Chief Commercial Officer at Discovery Health. Deon, thanks so much for joining us today. So it's that time of the year again, right? Discovery Health Medical Schemes announced a weighted average increase of 7.2% for 2026 from an actuarial standpoint. What's behind that figure landing where it has?
Alicia, thanks. I, I guess the important part to understand about the contribution increase is that it's effectively the scheme setting a budget for claims in 2026. So the 7.2% reflects what the scheme expects the claims in 2026 to be relative to what it was in 2025. So when we say contributions increase by 7.2%, what we effectively say is we expect the scheme to pay out 7.2% more in claims in 2026 than it did in 2025. And there's a bit of a process behind setting that budget. Effectively, we look at how much claims the scheme is currently paying, and then we project that forward, as you say, actuarially, to understand what the budget for claims should be in 2026. Now, there's two components to that projection. The first is the price of healthcare. Now, price of healthcare is simply what is the cost of a GP consult? So what's the rand amount that you get charged if you see a GP, or what's the cost of a night in a general ward in hospital? What is the cost of your script for your blood pressure medication? That's kind of when I say to the price of healthcare, I refer to kind of the unit price of it. And then the second component is the utilization of those services. So if everybody used exactly the same healthcare they did in 2026 than they did in 2025, the claims would only increase by the price of healthcare. But because people use healthcare differently year on year, we have to allow for that change in utilization. Now, as people age, unfortunately, it's one of those kind of effects of aging. You tend to use healthcare more. So as the members in the medical scheme age, they tend to use the healthcare system more. So people spend more time in hospital. They see the GP more often during the year, or more people need blood pressure medication. So the price of the healthcare goes up, but also the use of that healthcare goes up. And that then informs the increase in the claims. And once you have that, then you can say, well, if that's the budget and this is how many members we have, this is how much contributions we need to collect. And effectively that comes to the 7.2% that you've mentioned here.
Yeah. And it's key to the understanding, right? Because you've got to take that broader picture into consideration, especially when medical inflation continues to outpace CPI. So you've talked us through utilization trends, aging demographics, claims data, and how those get factored into the equation. Having said all of that, Deon, you've chosen to defer this increase to April 2026. So firstly, why the deferral? And secondly, what are the financial implications for the scheme, and how's that being funded or offset?
Yeah. So I guess the first point, as I said, is to set that budget. Second is to kind of set the contributions that you can meet the budget requirements, right? But I think like in any household budget, so if I've got a set of expenses that I need to meet in the following month, and I've got a set of income that I can expect during the following month, but I've got money in the bank, I can supplement the income with what's in the bank in order to meet the expenses. This is kind of a similar concept here. So the scheme determines at what level members have to contribute, but it also considers how much money it has in the bank. Now, the scheme holds reserves. That's effectively members' money. And if we express those reserves as a proportion of the contributions that the scheme expects to collect in total this year, it's about 30%. Now, that percentage is important because the regulatory requirement for medical schemes is to hold 25% in reserve. So we're above that regulatory requirement, which means that the scheme has excess reserves. It's got excess funds available. And so the decision was to use those excess funds to allow members some relief from the contribution increase, and only increase the contributions come the 1st of April. The difference between what members should have contributed and what they're actually going to contribute is worth about 1.5 billion rand. But that 1.5 billion rand will be taken from members' reserves. And hence, members are no worse off. The scheme's no worse off because between members' reserves and the contributions, there's enough money to fund the claims expectations for the year. And then that simply reduces the reserve levels. Now, that 1.5 billion rand doesn't put the scheme at risk because it will only reduce the scheme's reserves by about 1%. So we'll still exceed the regulatory requirement. So it doesn't affect the sustainability of the scheme, but it does help members in terms of the affordability of the contributions.
Okay, and obviously you're pricing risk into these equations as well, right? So I want to talk a bit about member behavior, Deon. Were there any noticeable shifts in utilization or claims patterns, general member behavior that influenced the pricing and the benefit design for 2026?
Yeah, I mean that's an important point actually. So a lot of the factors kind of that affect that utilization. So the inflation above the price increases year on year is quite similar from one year to the next. So typically looking at sort of the increase in the number of members diagnosed with a chronic illness, um, the rate at which members go to hospital, how much time they spend in hospital, how much healthcare is they use while in hospital. Those are all things that kind of impact that utilization number. So some of the unique features that we're currently seeing is that members are not necessarily going to hospital more often than before. But when members end up in hospital, the intensity of the service is much higher. So people tend to spend more time in an ICU bed or in a high care bed than in the general ward. Um, More specialists are seeing the patients while they are in hospital than in the past. It's kind of referred to in the healthcare parlance as generated spend. So we're seeing a greater increase in generated spend. That's one of the factors. Another factor that we're seeing is out of hospital treatment for psychosocial disorders. So more people consulting with psychologists, psychiatrists, or claiming for medicine for acute or chronic psychosocial disorders. I guess it's kind of a theme that we've seen coming, but that's certainly one of the other themes that's addressing this. But on the opposite side, though, something that we have seen, and I think it's as a result of some of the programs that we've put in place, is more people are engaging in their health than in the past. And when I say engaging in the health, is they kind of taking note of like how healthy they are and they're doing something about it. So we're seeing an increase in the number of people going for health screenings, um, taking advantage of preventative care benefits. The exercise rate in the scheme is increasing, and that's a good thing. So because the healthier people are, obviously the less healthcare they use, so that's got a ameliorating effect on the opposite impact of like increasing chronic illness, etc. So
Yeah. So how does Discovery Health, strike that balance then between financial sustainability and competitive pricing and then member retention, particularly at a time, Dion, when utilization, as far as I gather, as you've spoken, remains elevated, but then the pressure on affordability very real.
yeah, I think the philosophy that Discovery takes is that people should feel that the medical scheme is not just there to fund their healthcare when there's an issue with their health, but the medical scheme is also there to help them either improve their health or maintain their health. That makes the value of the medical scheme much richer because otherwise the contribution that you're paying is only for when you're sick. But if you're kind of in an environment where you feel the contribution that I'm paying goes beyond just when I'm sick, but it also kind of helps me to stay healthy or even rewards me for being healthy, that creates a richer value. So for us, it's kind of like balancing that equation. On the one side is making sure that the contributions are affordable. So initiatives like that reduces that trend of medical inflation over time is critical. So that's our work in terms of reducing the price, reducing utilization, um, using the scheme's reserves to defer the increases. That makes the contribution affordable. But critically, on the opposite side of that equation, how people perceive the value from the medical scheme is equally important. So members need to feel there's security in terms of the benefits. So if something really goes wrong, the medical scheme will be there to pay for it. But at the same time, also, if I'm concerned about my health and I want to do something about it, the scheme funds that as well. And then one step beyond, if I'm actually doing something really good about my health, the scheme actually rewards me for it. So that was kind of the principle with the introduction of the personal health pathway program at the beginning of this year, where we tell people this is a good thing for you to do to improve your health. Walk 5,000 steps this week, have your HbA1c tested, etc. And if you do that, we'll reward you for it, either through an instant reward or through extra benefits. But that's the kind of principle to ensure that members see value and retain members in the scheme.
Yeah. Looking ahead then into 2026, given the broader shifts in healthcare utilization and affordability, what's Discovery's outlook? And where do you see the biggest risks and opportunities sitting for members and the scheme alike?
Yeah, I think the biggest opportunity that the schemes have is to um, offer members greater value, or offer members value that kind of typically stay outside of the medical scheme. Um, and so I've mentioned personal health pathways. Along with personal health pathways, we've launched the Personal Health Fund this year. Now, the Personal Health Fund is a benefit. So it's money that is allocated to the member, and the member can use it for healthcare services, whether it's a visit to the GP or getting medicine from the pharmacy. And the way that the benefit is funded is through your actions. So we'll recommend an action to you to say that, go to the GP, go to the dentist, do this kind of preventative care, etc. And if you do those, we put money into the personal health fund, and then you can use the personal health fund for your interaction with the healthcare system. The scheme's allocated more than 200 million Rand to the personal health fund already this year for members' benefits. And members have used nearly 90% of that already for visits to the GP, medicine, etc. So enhancing kind of the value for members in that way helps in terms of retaining members and giving members control of kind of like how they earn their benefits and spend their benefits. And then because that kind of is working so well, doubling down on that PHF is important, the personal health fund. So we're giving more value into the personal health fund during 2026, advancing members some of their balance, giving them challenges that will allow them to earn even more into the personal health fund, and also enhancing how members can earn that. We've introduced sleep into the ecosystem. So apart from exercising that helps you to kind of earn money into your personal health fund, we'll also give you rewards for sleeping well. That's really important because of the data that demonstrates the causal link between people's health and the way that they sleep.
Yeah, absolutely. Well, Deon, thanks so much for having joined us on Smart Money today. It's been an absolute pleasure catching up with you. Deon Kotze is, of course, Chief Commercial Officer at Discovery Health.